spring has well and truly sprung, and the warmer weather now bringing challenges for the millions of Aussies who suffer from hay fever. It's all thanks to the rising pollen levels in the air. So what's the best way to manage symptoms, and how can you tell if you're being hit by allergies from spring or actually a cold or a flu? Here with all the answers, Sunrise GP Dr. Ginny Mansberg, good morning to you. It feels like everyone's sick.
Yes.
How do we know whether it's just hay fever?
And it can be really hard to tell. I would say clue number one, if you have a fever, that's not hay fever. And I feel like colds have like a typical pattern, like it starts with a sore throat and then you get the runny nose and the headache. You don't tend to get aches and pains with hay fever. But if you're going straight to the runny nose and itchy and watery eyes and then you get a bit of a sore throat, then that's more likely to be some allergies.
OK, how do we manage hay fever?
I think everybody just tends to go straight for the antihistamines, and they are not bad for like itchy eyes, itchy back of your throat. They're actually not great for a runny nose, and they work short term, but they're not good preventers. Some people wake up and take a Telfast or something like that every single day. It's probably not the best way to go with using antihistamines. If you really have a runny nose every single day, you're better off going to your pharmacist and talking about a nasal steroid, and they are sometimes have, that's a spray that you spray up your nose. Yeah, and you do those every single day, and particularly during hay fever season. Some of them have an antihistamine inside them. If things are getting unbearable, if you are tired, if you can't function, if you're starting to get other things happening, it might be worth going and talking to your GP and maybe getting a referral to find out exactly what you're allergic to, and even consider some like desensitisation therapy. You can do that with things sprayed up your nose or with injections.
Is there anything wrong with taking one of the over-the-counter nasal sprays every day for a few weeks?
So there are different types. The saline ones are great. They actually wash all the pollen out of your nose, actually, and you can use them all day, every day, no problem. The steroid ones are fine, just follow the directions on the packs. The one that we worry about a little bit are those decongestant ones. I also think they're like the Pac-Mans that get rid of all the mucus that's stuffed up your nose.
Yes.
The problem is that they can be quite irritating and then start to cause the problem that you're trying to get rid of. So they're not bad short term, but some people now then get addicted to them and have to start using them every single day because they're causing more of a problem than they're solving. So they're the ones I just...
So decongestant ones?
Yeah, just short term is great, particularly for a cold. I think if that's what you're relying on for your hay fever, I think we might need a different option.
A steroid one?
Yeah, so go talk to your GP about what's happening.
Excellent, there you go. Good luck out there. It's a tough spring.